dun sa kabila. Dun sa mga unang, laboratory dun sa mga dating na-mention natin na abnormalities or diseases kanina. Majority of those or all of those are having a prolonged or abnormally prolonged APTT test. So, yun yung mga naaapektuhan. So, I want you guys to remember this now that your hemophilia conditions and your contact group deficiencies would most likely to cause um, an abnormal prolonged APTT test. Again, inuulit ko. Lahat ng hemophilia cases, hemophilia A, hemophilia B, hemophilia C, and your contact group deficiencies. So you have your prekallikrein, your H-man factor, all of those would result to a prolonged APTT. But between these two, contact factor deficiencies would not result to a pathologic condition. Okay? So kahit ikaw ay na-diagnose ka ng H-man factor deficiency, that is nothing. Para lang ano siya, para lang siyang harmless disorder. Okay? Now, let's now proceed to the extrinsic and common coagulation disorders. So, simulan na po natin ang first disorder. You have your factor 7 deficiency. This is a type of an autosomal recessive disorder. So you have here 1 in every 500,000 populations are affected by your factor 9 deficiency. So the clinical findings for this one would be the hemorrhage from mucous membranes and your soft tissues. So you have to take note of the lab tests, a prolonged prothrombin time, as I was mentioning kanina. PT tests associated directly sa factor 7 deficiency or sa factor 7 activity. You have your factor 10. Okay? You have your factor 10, your Stewart-Prower factor deficiency. So this is an autosomal recessive disorder, and the clinical findings associated with this deficiency is there is some lifelong bruising, soft tissue bleeding, there is a post-surgical or post-trauma hemorrhages. Okay. Your factor X deficiency affects the culmination of your coagulation pathway completion. Why? Because factor X is a common coagulation factor. Yung factor X ang nagsisilbing interconnection between the intrinsic pathway and the extrinsic pathway. So they converge in the common pathway, and that starts with a factor X. So ano ang ma-observe natin? Parehong prolong ang PT at ang APTT test. Again, parehong prolong ang PT at APTT test. Okay? So the therapy that we require for here is your fresh frozen plasma and also your prothrombin complex concentrate. So this one, you have your factor 5 deficiency. This is also known as your Oren's disease or the Label factor disease. So this can be described as a deficient conjugation with factor 8C complex. Okay? So this can also be immune mediated. Why? Because there is a possible association or connection or production of antibodies against the factor 5 protein or the coagulation factor, which is your factor 5. So the clinical findings would include or would be the same as mild to moderate hemophilia. So same logic with your factor X deficiency or your factor 10 deficiency, your factor 5 deficiency also affects the extrinsic pathway and the intrinsic pathway because factor 5 is part of the common pathway, the pathway that converges the extrinsic and intrinsic pathway. So both the PT and the PTT results will be prolonged. Okay? So you have your factor 2 or your prothrombin deficiency. So this is an autosomal recessive disorder that can be a deficiency or a dysfunction. So dalawa po ang pwedeng mangyari dito. Perhaps there is a lackness of the factor 2 or perhaps there is an adequate concentration of your factor 2 but it is defective in terms of its function. So clinical findings would include same with mild hemophilia. Nakaka-encounter rin tayo dito ng hematrosis or bleeding of the joints. And the therapy for this one would be the fresh frozen plasma and vitamin K dependent protein concentrates because factor 2 is a type of a vitamin K dependent protein. So you have your factor 1 deficiency. So this can be classified into three or subtyped into three. You have your afibrogenemia. Meron tayong absence ng factor 1. Meron tayong absence ng, meron tayong decrease in factor 1. Okay, and meron tayong dysfunctional factor 1 molecules. So as the name implies, absence is a fibro, hypo is mababa ang concentration, and this fibrogenemia, dysfunctional ang ating factor 1 molecule or yung ating fibrinogen deficiency. So, clinical findings would include spontaneous bleeding, so mucosal, intestinal, and intracranial sites. So, the lab tests that will have a prolonged result in a fibrogenemia is we have a prolonged PT and PTT test. You have also a prolonged thrombin time test, reptilase time test, test rather. You have your thrombin clot test and your bleeding time. Bleeding time, okay? Why do we incorporate bleeding time for the diagnosis of your a fibrogenemia? Because platelets have a surface receptor for your fibrinogen. Okay. So you have here your post-coagulation stabilization defects. So this particular coagulation factor is necessary for the strengthening of your developed clot, okay, in your damaged blood vessel or your or your injury in your body. So factor 13 deficiency, if you recall, this is what we call, or your factor 13, this is what we call the fibrin stabilizing factor. So this is responsible for the connection or the polymerization of your fibrin monomers. So if there is a deficiency of your factor 13, there is there is a spontaneous bleeding, there is a poor wound bleeding and unusual scar formation. So the lab test that we will encounter for this one is there will be a soluble clot in the 5 moles of your urea solubility test, or this is also known as your Dockert's assay. Now, originally, in normal context, in the normal conditions, your clots are not soluble in your urea solubility test. However, since there is a lackness of your fibrin stabilizing factor, there is a deficiency of your factor 13, then there is no interlinkage of your fibrin polymers. There are only weak connections between the fibrin polymers that can easily be destroyed or ruptured or digested by your urea solubility test or your Doppler's assay. So that is how we assess your post-coagulation stabilization defects using your uh, urea solubility test. Okay, class, please give me 5 minutes. Thank you.